Hi, I'm Michael Sodini, and welcome to my podcast. I'm a third-generation firearms industry professional, so I pretty much grew up in it. So I want you to forget everything you think you know about guns and the firearms industry, because the guests that I have on are everyday awesome people that make up the Second Amendment community. Everyone has an opinion on firearms, but very few people actually listen to the individuals that make up the firearms industry. My next guest is special. Historically, in my short podcasting career, I have only had firearm industry peers on. But in this episode, I wanted to switch it up a bit because this guest has one hell of a story. Cultural competence with firearms applies to all professions, in my opinion, and sometimes we forget that. When I get the opportunity to present Walk the Talk America to different coalitions that work in mental health and suicide prevention, I get to meet some pretty neat people. My next guest, Dr. Loice Swisher, is one of them, an emergency medicine specialist. You're going to want to hear this story as it's an eye-opener for anyone who has ever been afraid to get the help they need in fear of losing their job or their Second Amendment rights. Welcome back to the Mike Sodini podcast, and today I have a special episode. This is actually a very unique episode because I think you're the first person that I am talking to on my podcast that actually isn't part of the 2A community, besides Jake, but Jake doesn't really count. Jake Wiskerson is a board member of WTTA because, you know, the history there, but you're the first actual guest from the outside world, I'd say, that's come into this podcast, which is kind of interesting. Introduce yourself, Loice.
Hi, I'm Loice Swisher, and I am the emergency medicine physician outside of Philadelphia. And as an unusual thing, it probably gets just a little bit worse than that because I don't even own a firearm. So I figure I am really unusual for this particular population. But I am very interested in suicide prevention, and I work with the Montgomery County Suicide Prevention Task Force, and I started the National Physician Suicide Awareness Day.
Yeah, and actually that's how we met. We were working with, would you say it's a coalition in Pennsylvania that's right? Yeah,
they're the Prevent Suicide PA had decided that they wanted to do a gun shop project. And so the people in the state contacted the different counties and were looking for people that were willing to represent the county. And I got this email saying, would you join the phone call? I joined the phone call, and there you were.
Right. And that, so one of the interesting things about what I do and kind of my journey in all this is meeting people. And I will tell you this as a gun person, right? Even though I consider myself like the ungun gun guy, like out of all the gun people in the industry, there's so many more that are like super gun guys. When I walk through these circles, I know I'm walking into places where they might not, there are people that I have to interact with that might absolutely hate what I do or what I'm about, right? From a gun standpoint, right? I'm not talking from the saving lives, right? But I know I have to sit with people that are like, man, I wish guns would all go away, and I hate the damage that they cause, right? Which I've always been able to appreciate, and that's why I never hold anybody, to this a lower standard because they don't see things the way I do. But one of the things that I've always thought was unique, and what I've loved about you, was you're very open-minded. You contacted me outside of the group, and we've had some discussions. And I love the way, because you truly are focused on suicide prevention. You don't want to see people to get hurt, right? And I love that, right? And that's really what makes you unique. And you've been mindful. Very mindful of actually the things that the 2A community cares about, right? Like you're one of the few people I know that is like literally like the language is important. the way you present yourself, the way you approach things, the articles you send me. And I want to say, like, I appreciate that. I think it's really cool.
Yeah, it's interesting because I think it's the same way, only reverse. I don't own a firearm and I'm going into the 2A community. And maybe that's going to be a problem. And what kind of stupid things may I say or not know? For example, I said, and what is SHOT Show? Because it seems like I need to know what that is because it keeps coming up. It's trying to get cultural competence in this area. So I appreciate you guys teaching me as well.
Yeah, it's there's a lot of overlap with kind of your mission and what my mission is, besides just saving lives, right? Like, that's the easy way to put it. But one of the interesting things is when we first started talking, I'll be honest with you, I didn't quite grasp where you were going with what you were saying to me, right? Like, it was because I never even thought about the physicians and the emergency doctors and that type of thing, right? Everything to me was just a mental health professional, like a clinician. And I realized, like, you actually helped me realize, like, oh, this applies to so many different aspects, right? Because I never got out of just, hey, therapist, right? Like, bring them into gun world or cultural competence or understanding that. So it was really, and I'm going to let you talk because I can go all day, but it was really interesting to hear your story and how it applies to, obviously doctors, nurses, everything like that. It's something that I just didn't even think of. And I think that they're almost like the forgotten first responder, right? Like, everybody thinks cops and the EMTs, but they never really think about the doctor or the nurse in the hospital and what they go through. And I know you have, like, a really amazing story, and I just want to hand it over to you because I think, like, people should hear it.
Oh, there's so many parts to that.
I know. I kind of set that up.
Where to start? So there are a lot of different parts. When you look at suicide as a issue, there are the mental health people. There are also attempt survivors. And may have some particular viewpoint on this and their rights. There are lost survivors that have the guilt of what they should have done or could have done and have that bent on it. There's people that own firearms that may or may not be suicidal, but have a lethal weapon, so get pulled into this discussion. From an emergency medicine standpoint, it was pretty simple. If you're talking about trying to prevent people from killing themselves with a gun, the best place for me to go is with people with guns.
Right.
If you don't have a gun, this is not an issue. And in emergency medicine, we deal with all kinds of people and problems. Some of it is social issues and homelessness. It can be hypertension and not getting their medicine. It can be diabetes and having trouble following diet and education. It could be that you have a gun, and this could be a lethal means at some point. And so I don't think we have as much judgment. It's like, just, well, how are we going to deal with this problem now? So when it came out that Pennsylvania wanted to do this gun shop project, okay, you have to go to a gun shop. And so it's not that I really have no fear. It just seems like the logical next step is that I have to go into a gun shop, and why should I don't need to have accompaniment. I've never been in one before, but when we walk through the door, I know how to stand at a counter and see how this goes. I was a little nervous because I didn't know how I'd be received. Mm-hmm. And I didn't know how to start the conversation. So I did say that I was with the Suicide Prevention Task Force, and we were looking to talk to gun owners. And as I started to talk, I realized gun owners and emergency physicians are exactly the same. Different issue, but exactly the same. Physicians do not like to talk about mental health. They don't want to go for help. They want to do it themselves. And the reason is that there is this immense fear that it will affect their licensing. They won't be able to practice medicine, so their livelihood will be taken away, and so they won't talk. I think that there's this same fear in the firearms community that if you start talking about mental health, that there really isn't any transparency of the consequences. So there is this risk that they could be taken away. And if you start asking about it, then it almost sort of puts a target on you. Well, maybe you're asking about it because you have a mental health problem. So the further you get down that line, the less you want to ask. Same for physicians. The further they get down the line of burnout and depression or addictions, the harder it is for them to ask for help. Like, this is exactly the same. We should be able to talk about this.
Right. It's a really interesting aspect of thinking, coming from like the emergency room doctor, right? I always talk about these people. There's people out there that I consider like human angels, right? If that makes any sense, right? If you think of an angel and you think of people that are like dedicate their life to helping people or doing something, and emergency doctors, I think, are there. Like that's how I see them. And it's really the NRA lashed out in response to a lot of emergency doctors, guys in the ER that were off put by the devastation of the bullet entry of like ARs. Do you remember that movement? Like,
I know exactly. Affirm.
Right. And I always thought that was the worst way to respond to a group of people that are on the front line of trauma, right? Even if you don't agree with the actual 2A rights aspect of that firearm, and there's all these variables within somebody coming into the ER with a bullet hole in them, right? But to tell doctors to stay in their lane I remember just face palming it, right? I remember like literally just face palming it, being like, this is not how you convert people or convince people that there's other solutions that we should look for together. But how do you feel about that? I mean, I don't want to put you out there to be thrown under the bus, but you've had to have dealt with being a doctor and just kind of being close to the people that are victims of gun violence or hurting themselves.
It's a big topic, and there's a lot of different viewpoints on that. I think in some ways with emergency medicine, there's the legal aspect of not being able to do research from the CDC and how you fund that. Looking at the other issues, accidents that affect people out there in the population, whether that's car accidents and seatbelts and pools with fencing around them and child-proof caps, choking hazards. It seems like there's a lot of things out there, and that the firearms is a hands-off, but we see it a lot. Mm-hmm. So there's a frustration with that. I want to start with the common ground, because I think that there is common ground. And if we get just to the suicide, because you can look at multiple aspects. You can look at domestic violence. You can look at crime. You can look at mass shooters. But if we can just start with how we prevent people from killing themselves, because with gun deaths, the majority of gun deaths are suicide.
Right. And I think it's important for my listeners to hear you say that, because that's something that we tend to think that no one really sees that, right? Like, so here's a non-gun person saying, yes, it's the majority of gun deaths, 2/3 is suicide, right? And that's right.
And if we don't talk about it at all, then there's 2/3 of the people out there that kill themselves that may have been able to access help if we were more open to this.
Right.
And so I think having that conversation is important.
Yeah, it's and obviously these are layups for me to plug Walk the Talk America, right? Because this is what I'm all about, right? Is having the conversation, and that's kind of what I was getting at. Is how great would it have been if the NRA would have been able to say, we hear you and we feel your pain, but here's some of the solutions that we're working on to try to help, right? To help the cause. Like offer solutions instead of tell people stay in their lane, right? Show them what we're doing and work towards things where we can find what you said is common ground.
I think there's, certainly with emergency medicine, I think there's a lot of common ground because we're really very practical. We know that we're not going to be able to completely stop drug abuse. We're not going to be able to stop homelessness, but we may be able to do some things. We may be able to do some harm reduction.
Mm-hmm.
And so talking about that harm reduction, knowing that we won't be able to change everything. You take the opioid epidemic, and there's been a lot of changes that have been put in place with limiting prescriptions and talking about addictions and what the symptoms of those are, putting into place ways that physicians can see how many prescriptions one person got. And then if they've gone from ER to ER to ER and have 10 scripts over the past 2 weeks, that's a person that I don't want to give. That's a person that I don't want to give another prescription to, because it is causing harm.
Right.
I think that this is another thing that we would like to figure out how to reduce harm, because suicide, not only with guns, it's a very fatal choice for suicide, but the amount of people that are affected by that is huge. The family, there's this guilt and trauma, and who found the person, and the questions that linger. Why did that happen? Could I have done something else? It is different than other deaths.
Yeah, I call it a trauma bomb. My experience started with a girlfriend, an ex-girlfriend. We had been broken up, but we had remained friends for years. And we, at one point, we had dated for 3 years, and we were young. We were in college, so we were talking about getting engaged. It was the first time I experienced it firsthand, but it wasn't by firearm. But in 2009, the president of my company, when I was in the industry, because I owned an importer, he took his life with one of our firearms at the at our office. He got a DUI, and he really felt that he, I guess, couldn't go on after that. I don't know what the thought process was, but the strange thing was, I was with him for 2 months, almost like every day, because we were traveling together. So when it happened, everybody wanted to talk to me about, they wanted answers, right? Like they would pull me aside, even at the funeral. They would, hey, I want to talk to you a second, like privately. And they thought maybe if they pulled me aside privately, I'd have some other information. And I didn't. And the worst part about it was watching, because you're in your own fog, right? Because you do that. You play those games. You're like, well, what did I miss? Or why didn't he feel like he could call me? But then you watch the whole trauma bomb, and it could go like over 100 people, that are devastated. So it's something that I wish we paid more attention to, and people understood why. Because I think they think it's like a victimless crime, right? Like they look at it and go, okay, well, that person obviously wanted out, but they don't realize the trauma and the crisis and everything that brings. It's not one person exiting and we'll be like, see you later. They're gone. It's tough.
Yeah, it's really something that we don't talk about. So we don't have the vocabulary and the comfort with the conversation. It's a difficult conversation. So people tend to keep it private. And when you're suicidal, I don't think, my belief is that it is not a selfish thing. That what is happening is that the pain of that moment is far outweighing how you can cope. And because it hurts so much and you can't see a way out, this is a way out. And it will help. Your thinking is such that you constructed that other people won't have to go through the pain with you that you were causing. So in their mind at that time, some people feel that it's an out for everybody else, so they don't have to be embarrassed or in pain watching what's going on. Maybe a weird way, but that can be the perception at that time.
Right. I always say because and I know you're pretty open about your battles with things. For me, I've actually never gone there. I'm one of the fortunate ones, right? I've never been in that space, and like I said, I've been super lucky, fortunate. Like that's the only thing I can chalk it up to. But when people ask me, I always try to say, like, that person that has that thought, that idea, and they're struggling with that, whether it's been for a long time or something that just happened and it was more impulsive, at that moment it must feel like jumping out of a burning building, where you either can go that way and burn in the fire, or you have to go that way and jump out the window, right? That's the way that I always try to explain it, and which is really odd because I've never felt it, but that's how I can make sense of it, right? Like that's how I can, because it's like watching 9/11 and watching those people jump from the top.
People jump off the building.
Right.
Yeah. It's exactly what I was thinking of. And I see suicide as more than just one way to get there. There are lots of ways. So it's different for different people. You talk about my story. So when my daughter was 5, and she is 25 now, she's healthy and doing Facebook and cooking. She lives with us. I'll tell you that right now. When she was 5, she developed a malignant brain tumor, and it was large. She had her diagnosis on a Friday, and if I really thought that she had a brain tumor, I would not have taken her on a Friday night going into a weekend. So they had to plan an emergency surgery, and that was that Sunday. They were wheeling her to the operating room, and she was yelling, "It's my brain tumor, and I want to keep it." And she's feisty. Came back to me, blind, mute, paralyzed, incontinent, unable to communicate in any way. But she could hear and think like a normal 5-year-old. I was just overwhelmed. I was the doctor. I was the one who signed the consent. I was the one that was supposed to explain this to my family and all the machines and everything that was happening. And if I had any idea what the prognosis was and if she was going to get better. And I had no idea because I really didn't know a whole lot about pediatric brain tumors. It really wasn't an emergency thing. And I didn't know how to be a patient because I had never been one, and I didn't really have a sick child before. So I didn't know how to do any of these, and I felt really incompetent. And there was nobody I knew that had been through this. So there was nobody I could talk to that could help me see the pathway. And the longer that it went in those first few weeks, the more guilty I became. I felt like it was my fault, and people would say, "No, it's not your fault. You did everything you can." But they didn't want to talk to me. They wouldn't sit down to say, "Well, why do you feel that way?" and really let those dark thoughts get out. It was trying to console me and make me feel better. There was no way I was going to feel better about my daughter. And so I internalized it. And as I internalized it, I eventually had to go back to work. I was off 2 months, but when I started going back to work, people would ask how I was doing, and I said, there's nothing going on that a merciful, this one was, if there was a merciful God, I wouldn't be here today, but I guess there's not. I work in a Catholic institution. Nobody said anything. And then I went a little bit further as days went on and said if there was 100 units of insulin, that would cure the situation. There's nothing going on today that 100 units of insulin wouldn't cure. I have access to that. I think that probably should have rung as much of a concern as a gun could take care of all my problems today. It's the same thing. Nobody knew how to talk to me. And I did get to the point of crisis. I never did attempt. Got to the point of sync with everything. And is it today or not? And if it's not today, I'm not going to think about this again. Obviously, since I'm here, it was no. But how you get to that next point, then of what do you do? What do you do with all those feelings? I decided that I was going to pretend that I was dead. Like no passions, no dreams, no
like
joys. You go to work, you come home, you just try to push all those feelings down and not have them. And I did that for 16 years.
Wow.
And I thought it worked really well. I mean, clearly I'm here and I did good things for people. I never got past that point really at the sink. I never healed. I just sort of froze in that time. 16 years later, there was a resident at the University of Kentucky who killed himself, not by firearm, but it was over a sick family member. And his program director wrote an open letter to the emergency medicine community where he talked about this and that it was related to a sick family member, how he felt like he didn't see it coming, that he was well liked, that they shared resources, and he felt guilty that it happened on his watch, that he felt that we needed to shine a light and speak its name and create a legacy. When I read that, I got to the bottom and I knew my life had instantly changed because I knew this guy, I knew by reputation, this guy was a good guy, well known. And if he didn't know, there was probably nobody else that really knew how to deal with this. And that's true. Program directors talk about the board scores and education and trauma, but how you take care of your own mental health wasn't something that program directors were trained to do. And since it's a apprentice type of thing, if the people don't know that, the next generation also doesn't know that. And what would have happened if 16 years before, or 10 years before, 5 years before, that I started talking about my story and felt comfortable that bad things weren't going to happen to me?
Right.
What would that have done to the community? Would we have been able to have other options for this young emergency doc in training had we just sat down and said, maybe there's things that we could do rather than if we talk about it, you might lose your license. People might not trust you.
Right.
As you say, I'm open that happened to me. And bad things haven't happened to me. People understood that it was a very, very stressful situation, and I felt responsible. And I had to be able to figure out a way to work that out. We have to make mental health less terrifying, that things will be taken away if you try to make yourself better.
Right. Yeah. It sounds almost cliche in this time and moment, right? Because mental health has been pushed to the forefront, which I see it more now all the time. Maybe I'm just more attuned to it, but I see more commercials, but it's very similar. So for the staunch 2A supporter, and how this relates, if they haven't already figured it out, is that we go through the same thing. Like, we don't want to lose our gun rights, and we don't want to lose clearances and things like that. And we will literally go to hell in our heads before we let that right get taken from us, right? And Mental Health America likes to call it. They have a concept before stage 4, because like when you hit stage 4, that's when it's way too late, right? And that's what we're trying to get to. Talk about it before stage 4. But it's really fascinating. So doctors, right? Because I think it's the forgotten people that people are like, well, they know how to handle that stuff, or they're used to seeing it, or whatever, right? What is your thought process on that? Like, how many doctors? Because I don't think people understand how many doctors do take their lives, right?
It's we don't have true actual numbers. The number that is out in the literature is 350 to 400. If you really go back to where that came from, that was an extrapolated number decades ago. So we really don't know because of the way they collect the data and how trustworthy you are of the accuracy of the data, whether that one car accident was an accident, or whether that one car accident was a suicide, or whether it was an accident, whether the drug overdose was recreational or intentional. So it could be a lot more than that 350 to 400. What we do know, though, is when you look at the percentage of docs that have been suicidal, you take a time frame. A lot of times it's going to be 12 months. 8 to 12% will say that they've been suicidal in that time. That's a lot of docs. 1 out of 10 have had an issue. And most of them won't talk to anybody. They don't talk to their family. They don't talk to their peers. They don't talk to a mental health person or their doctor. They just sort of shove it down and get through it. Mm-hmm. That's concerning.
I think a lot of those numbers are actually low, because it's like a lot of things in life. I think that when people are asked, it's easy for them to just be like, well, I've never felt that. Yeah. It's just an easier way to get on with a difficult conversation, or even bringing that up. Or I think a lot of people don't realize they are at some points, right? You said something earlier that you did 16 years.
16 years.
16 years. So I think it's important for people that are listening to hear you talk about 16 years. Because there's a lot of people that probably think, well, there's no way you can go that long. And you did. So that's like living in 16 years of torture, right? Like,
pretty much.
Yeah.
And it wasn't comfortable for everybody else around me, because that's not a fun kind of person to be around.
Right.
In a lot of ways, I pushed a lot of people away because it was protective. You didn't have to answer questions. Even things like, what would you like for dinner? That's a desire. I don't know. I don't know where I want to go. I don't know if I'm hungry. And by the end of 16 years, I didn't know a lot of things about me. That's not a great person to be around.
What made you decide to breathe after 16 years? Exhale. Like, when did you know you were out?
When that letter happened, I felt like it gave me a purpose in life.
Okay.
And it gave me a roadmap. Not exactly, but as a shine a light, speak its name, create a legacy. There you go. That's what you're going to do. And I knew very little about the theory of suicide or the community, what resources were out there. But I knew I wanted to speak about it in emergency medicine. And so I went to a couple of conferences. Right after conferences, that you can start putting in proposals for the next year. So there's this time gap, usually of like a month, 6 weeks, where you can think about putting in a proposal, say, I want to speak about such and such. Well, I think next year I'd like to speak about suicide. I don't really I have a personal story, but I didn't have a lot of understanding. Mm-hmm. So I had known, because of my daughter having a brain tumor, the internet was new, but I learned about websites and different groups, listservs. And that's where I started connecting with other parents that understood, had kids with brain tumors at different times in the timeline, and could help and talk about this. So from that, I got connected with people. In that 16 years, it's not like I didn't do anything. I ran brain tumor support groups, and our biggest one was pediatric brain tumors with 1,000 people on. And so I took care of other people and explained the medical terminology and helped them down the road. It just wasn't my story. I stayed sort of out of my life and just tried to help other people. But when I changed, my daughter became an adult. By that time, 16 years later, she was 21. We were done with pediatrics. It was sort of time for me to move on. This came up, and I decided I'm going to have to break here. What was the question? Where was I?
No, don't worry about it. We were basically talking about 16 years. And then what was it made you breathe?
Okay, now I remember. Sorry about that.
Yeah, go ahead.
Initially, with joining those listservs, I had this group of people around me. It gave me a purpose to help other people, and it helped keep my judgment of me being a bad person, a bad mother, a bad doctor. I was trying to rectify the sin, I guess. So that kept me going through those 16 years. When my daughter turned 21 and I was looking for a different community, a different path, I didn't know what it was. I was looking a little bit in medical education, which is how I came across this letter from the program director. When that letter came, I read it. I was like, okay, this is what I'm going to do. I didn't think that this was going to be the thing. I didn't think that I was going to be talking about mental health and revealing myself in such a vulnerable, personal way, but I don't know any other way to do it. So that was the time that it changed. I gave myself this cause, this goal that I wanted to go to, that I wanted to make it different in emergency medicine. And it would have to be across the country. Because if I had used those 16 years to spread my story and what happened to me, would that create a snowball that other people would start talking and we could change the culture? Even if I would have never met that program director, would in that 16 years the ripples happen that it changed everything, that they would know? They wouldn't have to know me, but it would have changed the culture enough that they would know that if another resident like that came along, that they would feel like they had more tools and skills to talk about it. So since I knew listservs, I went on the computer, and there's this American Association of Suicidology. Mm-hmm. Who knew? There's a group of people out there that study suicide. There's a group for everything. This is the group I want to belong to because I need some connections and I need some credibility and I need some content to put in this proposal. So I joined, and the very next day I sent in my proposal, and on other information, I wrote member of the American Association of Suicidology. Like it was 24 hours, but I'm a member and I put it in. And I did get to speak at three conferences the next year about this. And I thought that was like really important to try to connect into that community.
Right. There's an interesting dynamic that it's something that occurred to me. Like you made an oath to help people before this all happened, right? Like as someone, and then you're in it, and which most people would say like, hey, doctors, people that help people, like they're doing their part, right? But then you had this tragedy, and then went through this. And you came out of it saying, I want to help people. I want to keep helping people. I want to take it to the next level. I want to help my crew, my team, my emergency doctors and everything like that, the nurses and everybody. That's really fascinating because I don't know what makes people keep going. You know what I'm saying? Like you could go, you could help somebody, you could save somebody's life in that emergency room and go home and feel good and feel like an angel. Like, I did my part in society. Like, I do it every day. I help people. I help sick people. I help people that are wounded. But to keep going and to say, like, I want to tackle the idea of suicide. I want to make people feel comfortable talking about their mental health. And keep going. I mean, you should be commended for that. That's really unique.
Well, thank you. I appreciate that. I think in some ways, being an ER doc, that's my job. That's what I do. That's what I was trained to do. But I had such a sense of guilt and responsibility and self-judgment that the rest of it was my life. I needed to feel sort of some redemption for my life where I may not have lived up as the mother that I should have been. Was I attentive enough? I was busy. I was busy at my job. So when she was so disabled, and she's not disabled like that now, we had to do rehab. And in rehab, PT is the legs, OT is the arms for kids. It follows the developmental milestones of holding your head up and being able to sit independently and being able to crawl and being able to walk. And you did different things with your hands. And when you got a pincer grasp, there's like a zillion things. And as she was doing that, I knew every single one of the next milestones. And when she had the last one, the first time around, I don't know. I was at work. I wasn't there for her first milestones. Well, I'm being given the opportunity to learn the magic of milestones because I blew it the first time. Mm-hmm. So there was a lot of self-judgment on why this was happening. You can construct your reality different ways. And my reality of that time, I felt like I created a lot of that. And somebody has to be responsible. Somebody has to pay for that. And if it was my responsibility, I have to pay in some way.
Right.
When we got 16 years later, and I was talking to this program director, the first time we really sat down and seriously talked, I told him, Carlos is on my soul's tab. You can have anybody else that you feel responsible for, but Carlos, he's mine. Even though I never met him, I still felt that responsibility to this one. I think that trying to even the score was one of the things that I was trying to do. Mm-hmm. It didn't work. It worked some, And now that I've been in American Association of Suicidology, there's a theory, Joiner's theory of suicide. There's 3 overlapping circles. And if you have all 3 of them overlap, that is when you have the high risk of somebody actually doing an attempt. So there's the first circle is this isolation, that you feel like you're not part of a group anymore. You don't belong. You've gotten kicked off the island. And the second one is, they don't have to go in order, but the second circle that overlaps is a feeling of failure, a feeling of burdensomeness, a loss of purpose. And the third one is the capacity to kill yourself. For a long time, I'm like, man, do physicians always have the capacity? Do we always have one strike against us? Because we have prescription power. I have knowledge. I know how people die. I have thought about this. Docs have had times where they said, if you were going to kill yourself, what would you use? We have opinions. So, wow, gee, does that mean I always have to really worry about these other 2? They're important. But even if you help fix having a group of people like I had with my pediatric brain tumor parents, and even if you have a cause, something that you're doing to make you feel like you're less of a burden, and I did that with my lists, I still never really recovered in that period because I never understood that it was self-judgment and how to overcome that. The thing that you can do is have self-compassion. There's a woman, Kristen Neff, who has studied self-compassion. And there's different items. One of them is to lower your self-judgment. Another one is the mindfulness. And another one is to see how you're connected to humanity, that other people go through these problems and get through it. I think if we have those 3 things, the sense of belonging, the sense of purpose, and that can be just, my purpose is supporting my family and being with them, or your job, or a passion that you like to do, photography, that's something that you give to the world and beauty. It doesn't matter what it is, it's just what calls to you. And we work more with that self-compassion, the ability to give ourselves a little grace. And I think about your friend with the DUI. Those type of problems, there's been studies, this is out of the military, but relationship breakups, significant job issues, and legal issues are 3 of the triggers where people consider or complete suicide. And that's not really a mental health thing. It can be a conglomeration of things, but the sort of the thing that tipped it was a situation, whatever was available, whether it's insulin or a gun or you're driving your car into a tree, at that moment, your mind isn't thinking of the alternatives, what you could do instead.
Right. Yeah. I saw an interesting quote the other day, and I thought it was fascinating because it was real language. It was something real, and they said something like they were applying it to taking away a firearm, right? And they're like, you can change, and I'm going to screw this up because this is what I do. But it was something like you can change the course of someone's life in a moment, but can you change their behavior or what their ideology, right? Like, or their lifestyle. So it's like you could remove guns with a red flag law from somebody's house at that moment, right? And you're creating time and space, which everyone needs to understand that is real, whether or not we want to admit it for our 2A rights. And when a person is in crisis, you try to get everything away that they could possibly hurt themselves with. And that goes for knives, right? Like, not so it doesn't sound like I'm just picking up on a firearm, but you just made an amazing point, which I never even thought of. Like, you don't even need a firearm. You have access to medication and you're a doctor. Like, you, like that I never even really kind of put that in perspective, because everything to me was suicide by obviously, asphyxiation or firearm or going and standing in front of a train, right? And then you could also do pills, but you're a doctor. Like, you have a shortcut. You know what is the most effective way if you don't have access to any of those, but can still get your hand on medication. But it's changing. And why the quote hit me so hard was changing their life, right? Like, going forward, like, not just in that moment, understanding that you may have solved that problem for that day and created this issue, but how do you change someone's life? How do you get them out of that thought process? And that's why I'm kind of fascinated by your 16 years, because that's a long time to go.
It's a really long time. So there are people with recurrent and persistent suicidal ideation. And there are people with significant, difficult mental health issues with psychosis and schizophrenia. And there are people with drug addictions that have a lot of difficulty with withdrawal or a variety of social problems that come oftentimes with severe addiction. So you maybe have homelessness or a lack of a job, so you don't have the stability for the medical care that you need. There's that population. But there's a lot of other people that have suicidal ideation that aren't recurrent. And if you get through that episode, they may never have another episode. And certainly first of all, I'll say they will never have another episode. And the reason we know this is that there was a study looking at the Golden Gate Bridge. Golden Gate Bridge is a suicide destination. Your likelihood of dying if you jump off the Golden Gate Bridge is greater than 97%. I think they have nets going up, and that was a big thing, whether they should put nets up and whether people would then find another option rather than using the Golden Gate Bridge, and how that would affect tourism and the beauty. There was a lot of things that went to these nets. But if nets aren't up when the study happened, 90% of the people that were stopped, they have bridge walkers, angel walkers, that look for people that are alone and maybe sitting there and look like they're contemplating and how they can go up and approach people that might be thinking about going off the bridge. They particularly target days like Valentine's Day, Christmas, Thanksgiving, those holiday celebrations where people may be down because of their family or what they're thinking about. 90% of them did not go on to attempt again.
Right.
So you're right. There's the time where you take away the whatever. In this case, we'll say the gun. That may have prevented this episode, but if you don't work on helping with the coping skills, it's very possible that it could happen again. One of the things with people trying to go off a bridge, they sort of all get flagged and helped. They get taken away somewhere. People like me that was holding insulin, or somebody who's in their room alone with a gun, they may have put it away. They might have it taken before they actually do something because of the threat. But do they get help? Or do we have that next step to make a difference? So I agree with you. in that moment, it may make a difference, but if you don't change the course, you haven't changed the problem.
Right. Yeah, it's really interesting to think about. So when you said the Golden Gate Bridge thing, I think of the Kevin Hines story, right? Kevin Hines had a beautiful story, and for those that are listening that aren't familiar with it, Google it. But basically, he made a decision one day, and he said, if I get on this bus, I'm going to this destination where I'm going to jump off the Golden Gate Bridge. If anybody just asks me, hey kid, are you okay? I won't do it, right? And he didn't get that. He got there and he jumped and he lived, and it's an amazing story. But I think what's crazy about this conversation is I'm thinking about that. All he wanted was, are you okay? And all it took for you was a letter 16 years later that made you exhale, which is so wild. And I guess the lesson in there for me is, to anyone that has these thoughts and is listening to this and may have this ongoing struggle, is your letter might come, right? Like, it might be one thing that completely changes your course. And that's why it's super important with the work that we do. Because all it takes is one thing that inspires you to say, like, I want to be here one more day. And it's not always easy as what people tell you. It's not as, do it for your kids, or do it for this, or, do it for whatever it is, or look around you, look how great it is. Like, sometimes you're sitting there waiting on something, and it's almost like a small miracle. But I think that's pretty cool that you're able to vocalize that and say, like, it was a letter that made me exhale. Kevin was looking for that one thing. It's just you put it in perspective. I didn't mean to cut you off, but like, that's pretty cool.
I love Kevin Hines' story. I've actually been able to see him speak, and it's an amazing story because he does have mental health problems. He talks about it. He has bipolar and what that experience is like, and having been in and out of care in psychiatric institutions. One day I listened to a webinar that he was being interviewed, and he talked about in one of the times he was in the hospital that a family member came in with a magazine, I think it might have been Time, that talked about taking care of your medical needs. And this family member is like, look, you're going to have to live with this medical problem. You're going to have to figure out what to deal with it. You're going to have to make a plan. And he has this 10-point plan that he follows to try to keep him as balanced as possible. Just like asthmatics may have their medications and they know their triggers and they stay away from cats and they don't go around smokers, and diabetics have their insulin and they follow a diet and they go and check their hemoglobin A1C, that you can have some control over this. He was the first person, even through all medical school and being a doc, I was never told that you could have agency over these thoughts. One of the things that came up, he didn't say this, but you don't have to catch that train of thought. Mm-hmm. You don't have to catch that train of thought. So when it comes up, say, yes, we have that, that'll pass. We've been through this before. It's something you have to do, a distraction, go to sleep. Have rules that you live by. You're not going to do anything until you have slept 8 hours. You're not going to do anything unless you call somebody. And you take control of that. It does not have to rule you. And I was like, that is amazing. Mm-hmm. This person has a plan, just like everybody else with other diseases, heart disease, migraines. People with migraines carry their medicine. We shouldn't treat it any differently that the person is without any ability to care for themselves.
Yeah. I'm actually going to share a story with you real quick. That was, I don't tell this story a lot. I tell it to people that judge other people sometimes. When I was younger, in my party days, I ended up in a bathroom with a girl that I was very attracted to, and we had a cool relationship. And she pulled out, and this is going to sound really bad. She pulled out a meth pipe, and she just hid it in front of me. And to me, that, that, no matter where you think you are in your party days, what you think you could do and crush beers and whatever, that's what I considered like a super sketchy drug, right? And and I remember like sitting there and being like, I am sure she has been told a million times that this is bad, and I'm sure like she understands that. So I tried to like break the ice of the situation, and I was like, hey, you have a plan for that, right? And she like looked at me and she's like, what do you mean? And I said, you have a plan for that, right? And she literally like looked up and she was like, no one's ever asked me that. Like, it kind of feels good. And she's like, I do. And I know like a lot of people listening will probably be like, whoa, that's stupid. But cut to, I still know her, and she doesn't do that. She's off it. She's a mother and everything like that. But I feel like, and I didn't mean to do it. I just wanted to approach her in a different way than people probably would. Like, oh, that's bad and that's wrong and da-da-da-da. But, cut to, we had conversations about that. And she was like, that was a super empowering moment for me. Because you were the first person that kind of looked at me like, you got that. Like, right? She's like, I didn't feel like I was being talked down to or whatever. It was kind of cool. And that's a weird moment because I know I'm like, damn, I'm attracted to this girl and we have a great friendship and she does meth. Like, it's just bananas, right? When you try to look at it from, you can't rationalize it and you want to just like slap the pipe out of someone's mouth or really like, you don't need that shit. But then you go like, no, people have done that before, right? Like empower somebody. And I draw the correlation to what you were saying by, you can empower people too, that do battle mental health issues, right? Like, I hear it all the time. I'm like, don't let someone tell you what you can and cannot do just because you have bipolar disorder. If you haven't gone out and hurt yourself and hurt other people and everything like that, you're fully functional. You just have bipolar disorder. And how you manage that is up to you, right? But empower people in those situations. I think that's the most important thing. Does that make any sense?
It makes all kinds of sense. And I'm thinking of two stories. The first one, going back to the Golden Gate Bridge, and it's different Kevin. It's not Kevin Hines. I can only remember the last name of one of them. There's a TED Talk. It's called The Bridge Between Life and Death. And Kevin Briggs worked for the California Highway Patrol. When there was somebody out on the bridge, he was one of the people that was called to talk. To help take care of the situation of the person on the bridge. And as he approached this other Kevin, I can't remember his last name right now, as he approached him, he went over the side and was standing on the railing, on the beam on the other side of the rail. And the story goes that they talked for about 100 minutes. And he came back over the side. And Kevin Briggs said, what made you come back over? And so he had talked for 98 minutes. The guy on the other side of the bridge talked for 98 minutes. Kevin Briggs only talked for about 2 and came back and said, what made the difference was you listened. He didn't have to be defensive. Like, why are you over there? Come back over. Same way as you didn't make the person feel defensive. you allowed another path of thinking, which is what happens so often. There's the two sides, and you think it's going to be this side and that side. And when you find this other pathway, it sort of opens the door to other thinking. The great thing about your story is you got to see a further point down the road and how she is now, and that she's off, and that she says that was a turning point. So often we don't know, and you just have to trust that when you do that, some of the people that you talk to, it will make a difference, even if you don't know. So with COVID has been hit hard. Hospitals. I've been in a high COVID area. We've had people that we work with who have gotten sick. We've had people that we work with die. We know that we're at risk. It's a high fear time. Hospitals are losing money. People are being furloughed. If they're being furloughed, they may not be able to take care of their families. We thought that COVID was job security. It's not job security for anybody. So I have intentionally talked to people with greater authority than I have, because I worry about them. They're the ones that have to make the decision, and they're the ones that aren't looked after. So I've told people in my institution, I don't know what's going through your mind, never have to answer this. However, if you ever think about killing yourself, don't. And if you ever wonder if there's somebody that would talk to you, that's me.
Mm-hmm. Right.
And maybe that they will never need it, but having been there at the sink, saying, who could I talk to? Knowing, like, I could talk to that one. That would be my way out. You don't even have to use it. You just have to know that it's there.
Right.
It's really powerful.
Yeah, it kind of reminds me of, like, don't ever estimate the power of how are you doing, right? Like, that's what Kevin wanted when he was on the bus, right? Like, you holding up okay, or, hey, I'm here. You know what I mean? Like, I respect you, but if you... I think there's nothing wrong with being blunt, especially when it comes to suicide. Because I've had those conversations with friends that are going through divorce, and I remember when I went through my awful divorce, there were times when I just wanted someone to be like, are you good? Like, you wouldn't do anything to harm yourself. Like, that's the most important thing, right? But so I'm up front with those things. But I think the best thing to do with wounded people is to empower them and to let them know you're there. Like, so every time somebody, like, loses a family member, when they go on, or I hear from a second party, like, oh, Mike lost his daughter or something, I always send that person a text, and I'm like, I wish there was something good to say, but unfortunately there's not. And I'm like, but I'm here if you need me. And I leave it at that. Like, I leave it at that. Always I leave it at that. I'm right here if you need me. There's nothing good to say right now.
And that's good. I think that's important. My daughter, she's amazing. She learned and taught so much through that experience of having a brain tumor. So a few years after she was diagnosed at 5 and maybe 9, my uncle had gotten cancer. He wasn't doing well. He didn't want anybody to come to the hospital. And being a doc, knowing what was going on, it wasn't good. Mm-hmm. But he said, no family come to the hospital. My daughter goes, I'm going to the hospital. And Mom was like, you are? She says, yeah. What are you going to say? She goes, it doesn't matter what you say. All that matters is being there. And she did.
Right.
She we let the kid go in. And it opened that time up, and she was right, that being there is important. What I learned through the brain tumor experience, people would be coming up to me when I was not as destroyed as at the beginning. I was like, well, what's the secret? Well, the secret, there's only two things. One is people don't want to be alone. And the other is that they really want to be heard. They want to be able to share their fears and their concerns and not have other people minimize it or be horrified. That their concerns are concerns, but it's okay, and we're going to do this together.
Right. Yeah, it's... I hope everyone can understand that, right? Like, the hardest person right now listening to this who's like, I'm a machine or whatever, like, to understand that concept, it's important. You know, this I'm really glad we had this conversation. This is heavy stuff. Right, like people don't like to face these conversations. They don't like to have these conversations. And I've had you on for an hour. It's late, so I kind of want to close this up by giving you the platform to talk about the things you do and what's important and what people need to do. And let me tell you this: like, I know that we're going to work together a lot in the future. I knew that when we met. And you brought me into all the things that you were doing. So I really look forward to that. But I want to give you an opportunity to kind of wrap it up by saying, look, these are the things that I'm up to. These are the things that are important. And this is my message. And honestly, like, how can people get a hold of you if they want to talk to you?
Well, we'll start with the easy one first. I have a very unique name spelling. Loice is my first name. And so if you Google me, everything is out there. I'm on Twitter. I am on, the email is there. So it really is not hard to get a hold of me. Email is probably best because I had worked nights for 21 years. Now I work 6P to 3A, which is not really a night in emergency medicine. I keep strange hours, so that's the best way. As things to say. So I was listening to a podcast that you were interviewed on a few weeks ago, and that was with Colleen Noir. Mm-hmm. And as I listened to this, I had this feeling that there was this sense that people that don't own guns would never understand, and there would be no common ground. And how would they respond? And I listened to the whole podcast. I was like, I can agree with everything there. There is nothing controversial to me when we're on a lot of it, actually. It was actually on mass shootings. But in all of that and dealing with the mental health and what you do, I'm like, I can find a way to talk about all of this. This seems like really a reasonable thing. And I don't think many people who aren't part of the 2A community feel comfortable coming in and talking about this, talking about our common human issues. I think there's a lot more common ground. And our society right now is so polarized on a zillion different ways that if there's one place that we can say, we can meet in the middle and we can talk about this and we can make a difference, I want to do that because there is common ground here. There is ways to talk about how to approach this responsibly, because I won't be able to predict as a doctor who's going to kill themselves and who's not. I don't know. My best way is to be able to give them the tools and the skills and the resources to be able to protect themselves. And guess what? That's what the 2A community wants too.
Right. That's awesome. I love that. I think people need to see that. But I'm glad you're here. I'm glad you're with this movement and this. I think of the things that we do like a Venn diagram, right? And that's where we meet in the middle. And not there. There's good and bad on both sides when people start kind of judging or saying, well, those people will never understand. And so for us to have this conversation and for you to say what you just did, I'm really proud of you. I'm glad that, that's exactly why I do this show. I want to show a different side of life for other people. To say like, no, just because a person's not a gun person and they're a doctor, and they're concerned about suicide and mental health doesn't mean you can't have a normal conversation, and exchange ideas and have, I call it like the idea of playing with other people's ideas in a nice manner, right? Like it's fluid. And I feel like that's what we did here. So, I want to thank you, Dr. Swisher.
Nobody ever does that. Thank you very much. I really, really appreciate coming on. I think we can change things. That's my hope.
I think you're right. And that's why I haven't given up on humanity yet, even though every day social media makes me wonder. But I do look forward to working with you in the future. And thank you for what you do. And thank you for sharing your story. I think it's very brave. I think it's just something that should be commended, and people need to hear this. I think the whole thing is important. So I really appreciate it.
Well, I so much appreciate being able to come on and how you have come into the mental health community and giving your time freely when it wasn't your world before. There's a lot of power in that.
No,
there aren't many like you.
Thank you.
There's more like me than there are of you.
I appreciate that, and thank you. And you're right. I wasn't who I am. I mean, if you would have talked to me 4 years ago, it's a completely different conversation. You know what I mean? I had to learn a lot. I had to see a lot. I had to come in, and we didn't even talk about language and the importance of language and why we don't say things like crazy with a gun or the language that we've had, right?
There's a whole thing about language.
Right. And that's what I try to tell my people in the 2A community is like, hey, respect that. Like, I get it. Like, we don't want to, especially with the way the culture is right now in the United States, is like people are like, oh, these people are trying to do this and they want to change this. Well, we can be mindful of our language to understand that, especially when it comes to suicide, like words like commit, we could throw those out if that's what the mental health community is asking us to do, because it's proven that it adds to the stigma. Those are small prices to pay, right? Like, and what's great about it is, because I was the guy that said commit all the time. And there are people that still disagree with me, and I'm like, okay, you can disagree with me, but I see it. But the best part about it is there's so many people in the 2A community now, when they say the word commit and they're on a show or something like that, they're like, damn, Mike would yell at me right now. But
that's true of docs as well, because that's the way we grew up.
Right.
It's like peanut butter and jelly, cats and dogs commit suicide. It's just the way you say it. And you don't realize the impact unless you're part of that community and realize that commit carries this idea of a sin or a crime.
Right.
And it's not hard to change it to died by suicide.
Right.
The people that get it the most are the media. And it's a small price. Whether you agree, whether it's a sin, fine. I can believe all kinds of things as an emergency doctor, but for me, my oath, what I should do as a person is I want to help that other person there that's standing in front of me. And if I'm being told that using the word commit makes you feel diminished and makes you feel wrong and guilty, why would I use that word? Even if in the rest of the place I believe that, why would I want to do that?
Right.
My goal is to make people feel better and to make them whole, not to have that completeness. Why would I do something that would tear little pieces from them?
No, absolutely. All right. Well,
And I'm going to tell you a secret, though, a different secret. So when I get together and do these things, people ask me, are you worried about the 2A community? I'm like, I am never worried about the 2A community because they are really good at playing in the sandbox. The people who aren't good at playing in the sandbox are on the other side. Like, if we can have that common ground, some things we may not, and I don't know because we haven't talked about everything. But like today we're talking about suicide and we don't want people to kill themselves.
right.
Let's not go into this thing and that, the details of this case. Let's just talk about the vast number of people out there that are killing themselves, whether it's with guns or something else. Guns are the most lethal. But these type of things, the way you talk to people, the way you make them feel like they belong, asking them if they're okay, it doesn't matter whether it's a gun or they're thinking about jumping off a bridge. It works for all of them.
Right. Right. It's
Why don't
it's there's a saying there's a hashtag I use on social media, and I don't care what people think about me for using it, but I say socially conscious 2A. And the reason why I say that is I will say that we are called some really awful things. I've been there, right? As someone who doesn't really identify as a complete 2A person, right? Like, I'm not a boogaloo guy, but I understand it because I do believe in the amendments. I have sat there and had conversations with friends that are left of center or maybe super liberal, that say things about the 2A side, and I've been there and I'm like, that's just not true. What you're saying is just not true, right? Just like you can't blanket statement any group of people and say that's stereotyping, right? And that's what I love about this, what we're doing, and I really appreciate you saying that. Like, I do feel like the 2A people really do play well in the sandbox.
they're not the ones that throw sand.
Yeah, it's just
They never throw sand.
it's one of those things that I think the 2A community is so welcoming to everybody as long as you don't mess with the right, right? So it's I appreciate you saying that, and I do think socially conscious 2A, I think we can do better as well, right? We don't have to just be defensive. We can offer solutions, right? And that's really what I think a lot of people wanted from the 2A community.
Yeah.
They didn't want to be told to stay in their lane. They wanted to be told, yeah, we hear you. We're working on these solutions, and that was the biggest pet peeve of mine when I owned Eagle Imports, is when people, and I learned that from other mentors, like, don't come to me with a problem unless you have a solution. I don't care if the solution is garbage, right? Don't say, we have a problem, here's the problem, and not have a solution to fix it, or at least an attempt. And that's where I want to get us, right? That's my goal for the 2A community, is the language and coming forward to the table with solutions to say, hey, don't enact laws we have these things in place, and we'll do our best to recommend them to our people. All right. So I appreciate you saying that. I think that's cool.
And we're going to change the world.
Yeah, we are. We have a lot of work to do. We need the elusive 25th hour. But yes, we're going to change the world. But Loice, thank you so much. Thank you so much for coming on. This actually went a lot. I'll be honest with you. This went a lot better than I thought it would. I love that we were able to get into some deep conversation that some people are going to find it tough to hear, but it's fascinating. So thank you.
Well, thank you for having me on. I appreciate it, Mike.